Hello, this is Parsa Zadeh, and I'm doing a procedure today of extracting this cracked tooth and replacing it with an implant on the same day, and then covering it with bone graft and GTR. This is the preoperative PA of the tooth number 18. As you can see, this root most likely is cracked based on this widened periodontal ligament space, and there is an abscess here. So patient has a lot of pain. We can see the infection on the root here. It does show a very thin buccal plate and shortened buccal plate. So most likely we're going to lose this buccal plate when we take this tooth out. As you can see, it's almost perforated here, and that's where that so-called gum boil was there. Another important thing to notice here is the nerve is all the way down here, so we're not anywhere near the nerve. Another thing I want you to notice, which is the subject of a few of the videos, is that there is another area here that by itself can look like a small nerve. Now, fortunately, both of these are away from the area we're going to be working. But if we were counting on the exact distance of the working area to the infraalveolar nerve, we should not ignore the smaller area on top, because I have seen cases that there are two nerves coming down to the mental foramen and the anterior region. And even though one of those the main nerve is preserved, the smaller nerve, if that has been penetrated, then the patient will experience the numbing. So this is a good case to show that there are two. This is one of those cases that have two nerves involved. It doesn't show it clearly on this view, but on the cross section we can see that. As we can see on this X-ray, the second molar has a lesion around it, and the patient has severe pain. And soon I'll show you with the intraoral video that the tooth does have a abscess, a gum boil. Actually, you can see here on the buccal there's a gum boil, and on the lingual also. So we'll start by numbing the patient with the infraalveolar block, then placing an incision around the tooth here to separate the gum from the tooth. And of course, this crown would come out very easily, so we'll have to most likely split the tooth, which the crown came out. I have used a 557 surgical to split the tooth. Now there's a mesial root that comes out. You can see the crack line and the granulation tissue connected to the tooth.